Even though our face is layered like an onion, there is a connection between these layers that changes with age. This is why we can see the signs of aging the same way in all faces. Actually, the connections between the different layers of the face are affected by the structures that stretch from the skin down to the bone. We can sometimes see these connections between 2 or 3 layers, and at times they might stretch all the way from the surface layer to the deeper layers. If these connections reach the bone, they usually appear as fixed marks on all faces, and we can see where they connect. Sometimes the skin is stretched. It can extend to the bone, sometimes showing layer connections. Reaching the bone, they become fixed marks. Most faces show these connections. Few connections may cause wrinkles in some, not others. Wrinkles under eyes extend to bone, rounding with age. Similar wrinkles appear or branch out. Chin areas show similar patterns. But if a few links are linked, we might see lines in some people. One common area we see in everyone is the links under the eyes that extend towards the bone. This leads to lines near the eyes. We see these lines similarly in people. They might show up, but in some they can branch out. Other areas near the chin have links from the skin to the bone, so we see these lines in faces. However, there are lines that connect a few top levels. We want to reach the face level that changes, which many might not notice. Around the eyes, when they become rounder, we see wrinkles. These wrinkles may appear at one level, but in some people, they can branch out. Other areas, like around the chin, have similar patterns. There are structures that stretch from the skin to the bone. However, there are also wrinkles that connect a few surface layers. We aim to reach a facial layer that changes with age, often unnoticed. This layer is the underlying layer. There are structures that stretch from the skin to the bone, and that's why we see these wrinkles similarly in all individuals. However, there are also wrinkles that only connect a few surface layers together. Continuing from our previous discussion, we want to reach a layer of the face that also undergoes changes with age, which many people might not pay much attention to. And this layer is the muscular layer. The muscles somewhat atrophy and lose volume as we age. We can see that the tone and strength of the muscles decrease with age. We can clearly observe these changes. If we look at the muscles of a young person and then compare that same person, in old age, we can see that overall, the tone and strength of the muscles decrease with age, and the volume of the muscles in the face also diminishes. Since the muscles are more delicate, many of us might not have paid much attention to this, but we can clearly observe these changes by closely comparing photos from youth and later years. By comparing photos from youth and old age, we can see the most noticeable change is in the lips. We can get to The most noticeable change you can see is in the lips. The muscles of the lips atrophy, which leads to a decrease in the volume and thickness of the lips, as well as a reduction in the mucosal surface of the lips. Another area where the muscles atrophy is the masseter region, where one of the chewing muscles is located. As we age, this muscle undergoes atrophy. In addition to the muscle atrophy, we also experience fat loss in this area. This combination makes these signs of aging very noticeable. Another area where we can see changes in muscle volume is the angle of the jaw. Another area where we can clearly see these signs is the angle of the jaw, which is clearly visible and noticeable. The jawbones, especially the young jawbones, are very ancient, but these young jawbones deteriorate over time and lose some thickness. This leads to a change in the angle of the jaw as we age. The effects of the jawbones aren't limited to the bones themselves. They can also impact the surrounding tissues, especially the soft tissues, and the deterioration starts in these areas. As the jawbone deteriorates, the bony tissue it supports deteriorates. We aim to reach deeper facial layers. We'll see bone changes with age. Aging causes jawbone deterioration, removing tension and pressure. Young and older teeth show that the bone deteriorates, leading to gaps and more pronounced teeth. We aim to reach the deeper facial layers. Let's explore how bones change with age. As we age, bones deteriorate and the pressure on them decreases. Comparing young and older teeth, we see that reduced pressure leads to bone deterioration, creating gaps. The jaw angle also deteriorates with the jawbone, leading to less defined angles and indistinct neck and surface areas. As we age, the jawbone deteriorates, removing tension and pressure from the bones. Comparing young and older teeth, we see that decreased pressure on the bone leads to deterioration, causing gaps and more pronounced teeth in older individuals. The jaw angle also deteriorates, resulting in less defined angles and indistinct neck and surface areas. Cheek and chin areas show similar deterioration. Enhancing bony areas can significantly rejuvenate the face, especially where deterioration is noticeable. Regarding the eyes, bone deterioration occurs in areas like the upper corners. In older individuals, we see that another area showing deterioration is the jaw angle. With the deterioration of the jawbone, this area loses definition, and we notice that older individuals often have less distinct jaw angles, which can blur the boundaries of the neck and face. Similarly, we observe deterioration in the cheek and chin areas as well. What's interesting is that many people don't realize that enhancing the bony areas can play a significant role in facial rejuvenation, especially for those who notice more deterioration in these areas of their face. There's an interesting point regarding the eyes. When bone deterioration occurs, it mainly happens in areas like the upper corners and inside and outside the eye socket. This leads to the eye socket becoming more oval or slightly elongated from both sides, and its internal volume increases. This change causes eyes that have a certain volume to sink deeper into the eye socket, which has now expanded, making the eyes appear rounder. The deterioration occurs more inside and outside the eye socket, which causes the eye socket, which is usually oval, to stretch a bit from both sides and increase its internal volume. This change makes the eyes, which have a certain volume, sink deeper into the now expanded eye socket, making them appear rounder. The eyes themselves sink into the socket, making them look rounder.